prakteknya di panti jompo. Kesannya kerja di Jepang gimana ya? Nano-nano lah.
Minasan, konnichiwa. Hajimemashite, watashi Yesi desu. Sari to yondemo kamaimasen node yoroshiku onegai shimasu. Halo teman-teman yang ada di Prodi Blitar, perkenalkan nama saya Yesi. Saya alumni Poltekkes Malang Prodi Blitar lulusan tahun 2014 dan sekarang bekerja di Jepang. Saya di Jepang sebagai care worker di sebuah panti jompo yang ada di Prefektur Okayama, Jepang, memasuki tahun kedua.
Program studi D3 Keperawatan Kampus Blitar siap mengabdi kepada masyarakat demi kemajuan bangsa Indonesia. Selamat datang di program studi D3 Keperawatan Kampus Blitar Politeknik Kesehatan Kemenkes Malang. Demi menunjang aktivitas pendidikan dan pembelajaran, program studi D3 Keperawatan Kampus Blitar berupaya untuk menyelenggarakan program pendidikan vokasi yang sesuai dengan standar nasional pendidikan tinggi dan sistem penjaminan mutu.
Program studi D3 Keperawatan Kampus Blitar berkomitmen menjadi program studi yang berkarakter dan unggul di bidang keperawatan, kegawat daruratan dan bencana di tingkat nasional dan internasional, serta mampu menjawab kebutuhan tenaga keperawatan yang siap mengabdi ke masyarakat.
Guna menghadirkan atmosfer yang mendukung perkuliahan, program studi D3 Keperawatan Kampus Blitar menyediakan fasilitas yang memadai, mulai dari ruang kuliah yang nyaman, perpustakaan, ruang ketua prodi, ruang dosen, ruang BK, studio Philip, auditorium, gazebo, taman refleksi dan herbal, musola, serta sistem layanan peminjaman laboratorium secara online yang dapat diakses secara real-time melalui lab observation. Program studi D3 Keperawatan Kampus Blitar juga memiliki 7 ruang laboratorium kompetensi keperawatan yang dilengkapi dengan alat-alat berteknologi canggih dan sesuai tuntutan kurikulum meliputi Laboratorium Keperawatan Dasar, Laboratorium Keperawatan Maternitas, Laboratorium Keperawatan Anak, Laboratorium Keperawatan Jiwa, Laboratorium Keperawatan Komunitas Gerontik dan Keluarga, Laboratorium Keperawatan Medikal Bedah, Laboratorium Keperawatan Kegawat Daruratan dan Bencana, sebagai laboratorium kegawat daruratan pasien pra-bencana hingga pasca bencana, termasuk memberi rujukan terhadap pasien darurat bencana. Laboratorium ini merupakan laboratorium unggulan dan penciri untuk mencapai visi program studi D3 Keperawatan Kampus Blitar. Selain itu, program studi D3 Keperawatan Kampus Blitar
Okay. Hello, Professor Fu-Chih.
Hi, how are you?
Yes, I'm very well, Prof. How about you, Prof?
I'm good, very good.
Yes,
however, I just cannot. I don't know how to switch to the background that like you, or I already download it, but I will try to use the background. But
yes,
maybe it's okay because my background is still very light. It will be okay.
Okay.
Yep.
Actually, long time no see you, Prof.
Yes, yes.
So today you stay in Taiwan or other country?
I'm in Taiwan and I'm in Taitung. So actually, I just finished one long-term care consultation meeting with the Taitung County Mayor. She, the mayor. So I am the committee. So I just give them the suggestion for long-term care and finish lunch, then come back to give a lecture to our Indonesia friend.
Okay. Thank you so much, Prof.
Yep.
Okay, 3 minutes later we will begin, Prof.
Okay, so Ed, can you send me your YouTube link? Because
Oh,
I send the YouTube link to my line, then I can see that. Yep.
yes, Prof. Wait a minute.
Okay.
Okay, all of the committee, we can start this meeting.
Okay.
Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Om Swastiastu, Namo Buddhaya, Salam Kebajikan. Show how for Professor Fu-Chih, RN PhD. The Honorable Head of the Nursing Diplomatic Study Program, Dr. Sri Bugianti, SCAP Nurse MCAP, whom we respect. Our speaker this afternoon, Professor Fu-Chih, RN PhD, whom we respect, lecturers and fellow academia of the Nursing Diplomatic Study Program, whom we respect, the participant from Trenggalek Nursing Study Program, Ponorogo Nursing Study Program, Kediri Midwifery Study Program, and our loving audience. First of all, let us pray to the Almighty Allah Subhanahu wa Ta'ala. Because of His blessing, we are able to come here to join guest lecture of the Nursing Diplomatic Study Program. Secondly, may peace be upon our Prophet Muhammad Sallallahu Alaihi Wasallam, who has guided us into the right ways of life. Ladies and gentlemen, my name is Kuroto Ayun, as the Master of Ceremony today, on 23 November 2021, a joint guest lecture of the Nursing Diplomatic Study Program with the title Emergency Pediatric Nursing. We would like to extend a very warm welcome to all of you. We appreciate and thank to all of you taking time of your schedules to join this program, participate, and share together about emergency pediatric nursing. We hope this program will give an advantage for us in the future. Well, in this special afternoon, we have several agendas. I, as Master of Ceremony today, I would like to outline all the agendas are as follows. The first agenda is opening. The second is listening a national anthem Indonesia Raya and Polkesmas hymn. The third is committee report of this program by Ervina Diah Pangestu. The fourth is welcome speech delivered by Mrs. Dr. Sri Bugianti, SCAP Nurse MCAP. The fifth is speaker's resume reading, continue with a material delivered by our speaker, Mr. Professor Fu-Chih, RN PhD. The last agenda are prayer, documentation, continue with closing. Well, to take the advantage of the quality time, let us open this program with Basmala together. Bismillahirrahmanirrahim. Ladies and gentlemen, now let us listen the national anthem Indonesia Raya and Polkesmas hymn. So for the audience, please sit up straight. The next agenda is committee report by Ervina Dia Pangestu. To Ervina Dia Pangestu, time is yours.
Assalamualaikum warahmatullahi wabarakatuh. Please for all of us, the Honorable of the Nursing Study Program, Mrs. Dr. Nursing Mugianti MCAP, whom we respect, ladies and gentlemen, lecturers and academic community of the Nursing Study Program, whom we respect, Professor Fu-Chih LLM PhD, as guest lecturer on this afternoon, as well as to all the guest lecture participants. First, they've all let us say praise to God how give thousand the favors to us on this day, so that we can gather at the guest lecture Pediatric Nursing Study Program, Malang State Health Polytechnic, with the theme Emergency Pediatric Nursing on November 23, 2021 in a healthy state. I'm Ervina Dia Pangestu, as the committee representative of the guest lecture, would like to welcome and thanks the audience for coming to the guest lecture in this afternoon. Also thank all the committee and colleagues who have helped in organizing this event. My goal in organizing this event, namely, 1, to obtain information about the importance of the nurse role in the care of child nursing care. 2, gaining knowledge about children. 3, know how to manage in helping children who need help quickly. 4, implementing the Student Association's work of Pediatric Nursing Diploma-3 Study Program. Let's just follow this event well so that it can run smoothly and we can get the benefits. Finally, if there are any shortcomings in organizing this event, I apologize. Welcome to join this event and hopefully useful. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you for the report, Ervina Dia Pangestu. Before we begin our main agenda, we are pleased to have to deliver opening speech. Mrs. Dr. Sri Mugianti, SCAP Nurse MCAP, time is yours.
Thank you, MC. Yeah. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone. Selamat siang. Honorable the speaker today, Prof. Fu-Chih from Taipei Medical University, Taiwan. Hello, Prof. Lei.
Nice to meet you.
How are you?
I'm good, thank you.
Yeah. Yeah. Have you ever been to Indonesia?
Yes, I went there one time. Actually, I went there two times. One time I visited UGM. I had a speech there. Another time I attend the 2016 World Society Disaster Nursing Conference in Jakarta.
Oh, in Jakarta, yeah.
Yeah, and actually my uncle lives in your city, Malang, right now. He lived there for more than 30 years.
Yeah, I hope someday you can visit here in Blitar or Malang.
Yes, yes.
Yeah. Nice to meet you.
Yeah, same here. Nice to meet you too.
Yeah.
Nice to meet you.
Yeah. Mr. Andi said to me in Taiwan, their land beautiful 101.
Yes. Yes.
Icon in Taiwan. Yeah. Yeah. Okay. And also honorable to our lecturers and staff of State Health Polytechnic of Malang. Also to my student whom I love. Emergency nursing is perhaps the most challenging part of the profession. And when I come to pediatric emergency nursing, it definitely takes a special breed of professionals to bring about significant change in the life of the little patient.
Yes.
I am very happy and grateful for the guest lecture today with theme emergency pediatric nursing. Yeah. For all my students, you are the future nurse. So the guest lecture today is very important for you. Yeah. And we have Prof. Lei as the expert to deliver the material about emergency pediatric nursing.
Yes.
So please the attention to this guest lecture. Yeah. And I want to say thank you, Prof. Fu-Chih for your time to share your knowledge and experience with us. It is
Yes, my honor.
an honor for us.
Yes.
We are welcome. Do you come and visit Blitar one day when the COVID pandemic is over?
Yes.
Yeah. Well, thank you for attention. Good afternoon. See you. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you.
Waalaikumsalam warahmatullahi wabarakatuh.
Thank you for the speech, Mrs. Dr. Sri Mugianti, SCAP Nurse MCAP. The announcement for participants, the attendance form has available in room chat, Zoom, and YouTube. So for the participants, please fill the form. Ladies and gentlemen, the next agenda is reading speakers resume. Continue with our main agenda, the guest lecture of the Nursing Diploma 3 Study Program with the title Emergency Pediatric Nursing, delivery by Mr. Professor Fu-Chih, RN, PhD. For this agenda, I hope the audience will take notice from the beginning of the material to the end. And the session, moderated by Mr. Andi Hayun Abidin, SST MSc, as moderator. I invite you to take over the session.
Thank you, Ms. Furotu Ayun, SMC. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone. I am Andi Hayun Abidin, and on behalf of Diploma 3 Discharge Nursing Department, State Health Polytechnic of Malang, I would like to welcome you in guest lecture with an interesting topic about emergency pediatric nursing. As for information, actually this topic related with our school patient becoming a vocational nursing study program that has character and excellence in emergency and disaster nursing. Okay, before we begin, I would like to share with you the house rules of this event. For the first rule, this event is recording the whole webinar session. By attending this event, you acknowledge that your image and comments may be recorded. For the last rule is please type your questions in the Zoom room chat, or you can ask directly in discussion session. For the next, I would like to welcome our speaker today, Professor Fu-Chih, RN, PhD from Taipei Medical University, Taiwan. Good afternoon, Professor.
Good afternoon, Andy, and our students and our faculties. Good afternoon.
Yes, we hope you are always doing great and healthy there.
Yep.
We
Sure.
are glad you can be a speaker at this event today. Before that, I would like to read the detailed personal information of Professor Fu-Chih. For the committee of this event, please help me to share the PPT of personal information or CV of Professor Fu-Chih. Panitia minta tolong. I'm sorry, Prof.
Okay.
We use two language.
Okay, so do you want me to share this one with you now?
No. About the CV.
Okay. Hold on.
Panitia.
Okay. So, what do you want me to know? Share the University of Taipei Medical University?
I mean your CV, bro. Because
Okay.
We have committee and
Mhm.
we have one of committee have a job to share the CV if your CV.
Okay, sure.
Yes.
Sure.
6 minutes, bro. I'm sorry.
Okay, don't worry.
Panitia minta tolong di share screen PPT CV-nya Prof. Okay. Yes, this is the Prof. Fu-Chih personal information. For the first, about the education background, start from bachelor. He got bachelor degree from College of Nursing, Taipei Medical University in 1994. And in 2002, he got master degree at Case Western Reserve University, Ohio, USA. After that, he received his doctoral degree from Kent State University, Ohio, USA until 2007. And the most interesting is Professor Fu-Chih is the first Taiwanese male nurse who get PhD degree of nursing, currently resides in Taipei, Taiwan. For the second, next, okay. For the second part, work experience start from 1996. The first slide, please. Start from 1996 to 2000. He is an emergency nurse at Katai General Hospital, Taipei, Taiwan. When he took doctoral degree, he is a research assistant at Kent State University, Ohio, USA in 2002 until 2007. After he got doctoral degree, he moves to College of Nursing, Taipei Medical University as an associate professor until present. Well, so many experiences that he has, like in nursing educational field. He is a faculty that teach medical, surgical, emergency disaster nursing, and long-term care and healthcare delivery system. And me, one of his student when I master degree. He has involved with adopting OC simulation and virtual reality to enhance nursing student and staff awareness of patient safety and quality improvement. Of course, he also has published several articles to international journal regarding nursing care, disaster, and nursing management. Okay. For the next work experience in nursing management, he has involved with quality nursing work environment, project, and nursing workforce reform program funded by Taiwan Ministry of Health and Welfare. In leadership field, he actively serves as a general supervisor of Taiwan International Classification of Functioning Health and Disability, or ICF, Research Society, and the Deputy Chair of Disaster Nursing Committee, Taiwan Nurses Association since 2012. Okay, well, that's all the CV of Professor Fu-Chih. Okay, so please welcome Professor Fu-Chih. Time is yours. Thank you.
Okay, thank you very much, Andy. That means Let me go to share with you of my PPT. Please wait a moment. I'll open the file immediately. Okay, hold on. So good afternoon, everyone. It's very nice to see all of you, and especially to see my student Andy. Actually, in one of my class, I have one PhD student. Also, I believe, I forgot his name, but I believe he's also, I think Andy's friend, because he knows Andy. Andy, do you know who he is? He says he knows you, and he study in TMU right now.
Yes, I know him, but I little forget.
Okay. So now let's start my today's presentation. So now can you see the PPT that I'm going to share with you now? That's
Yes.
today's topic. So I think today, because I have roughly an hour, maybe around 15 minutes. So I will do my best to talk about the emergency pediatric care. I work when I was, after I graduated from Taipei Medical University College of Nursing for my bachelor degree, and I served in the Army for almost 2 years. That's because at that time, there's every Taiwanese men's application. So after discharge from the Army, I started to work in Taipei Cathay General Hospital emergency room. So I worked there 4 years before I went to study my master and a PhD in the United States. So I will share with you those issues that what we have to provide care to pediatric population. So before I started, I would like to ask you, our student, most of you are bachelor degree student or you are graduate student, our audience today. Andy, do you know they are bachelor student or graduate student?
Undergraduate professor, especially in diplomatry.
Okay, diplomatic. Okay, so let me ask our audience, how many of you have ever done your clinical practicum in ER? Or have you been to emergency room before? Anyone? When you are a child, or you bring your family, or you accompany your friends, children to there? Or how about you, Andy? Have you brought your kids to ER? Did you?
Until now,
No?
I never.
Okay, that's good. But for someone, if you have ever bring your children or went there with your family, and your family, they are children who visit ER, I think this is the patient flow, how you step by step to go to the ER. And that is the information we need to be very careful if you are a nurse working in the ER. So here you can see 6 boxes. From the beginning here, this is a transportation and a companion. So when I was working in ER before, we always have the car stop very, very quickly in front of the emergency room. So you can see the family, they are very, very anxious. They just bring their kids rush into the ER. So first one is how they come to ER. That would be the transportation. Did they go to ER by ambulance, by taxi, by motorcycle, by driving themselves, or they walk in? Why? Because this will give you some hint, some reminder that kid's situation. Another one will be the companion. Companion means who visit the ER together with the children. Sometimes they may be parents, sometimes maybe grandfather, grandmother, sometimes maybe the teacher from kindergarten because the kids, they are at school, right? Some are even accompanied by police because they have been abused or domestic violence, or the children, they just rescue from somewhere, they have a disaster or they have fire. So those are 2 important factors that we have to observe from the beginning when the children visit ER. After that, usually they will go to registration because they have to check in to share with us their personal information like their ID, their insurance, or maybe they have a medical record in our hospital if they have ever visit your hospital, or they never ever visit your hospital. So that would be first time for them to registration. So if you are a triage nurse, you need to be very careful to observe those information. So as a triage nurse, let me give you some explanation. What is triage? Triage actually is a French. This means how we screen different sizes of fluid at the beginning in France. So in emergency room, the triage system is very important. They will make sure your patient has been seen by the priority or by the severity or by appropriate specialty of those children. So the triage nurse, they are very important. I think for our student, if you graduate and if you go to emergency room, usually the triage nurse has a very high level of requirement. Some hospital, they even require you need to have at least 2 years of working experience, specialized in ER. And of course, you need to receive different kind of training, internal medicine, surgical nursing, internal nursing, pediatric, obstetric, even trauma, all kind of that. So the triage nurse is very, very key person to decide how fast the children can be seen by the doctor. And their appropriate triage system will help the patient to be seen as soon as possible. So of course, sometimes triage nurse is a very tough job. Why? Because every parent think my kid is most important. I want my kids to be seen as soon as possible. Just get the doctor to see my kids. I don't care what happened. I don't care other kids. That's every parent's their thought, right? So sometimes triage nurse have to be very careful to give them the different triage level. So sometimes some children, they come to ER earlier, but they might be seen by doctor later. Why? Because their triage level are lower than others, they come later. So the triage is also important. So after we give them triaging result, we will send the children to examination room, or they might receive some chest X-ray, CT, or we might withdraw some blood. And based on the finding and based on the situation, we will give treatment to the children. So when you want to give treatment and examination to the children, there's one thing that is very important, and it's related with the safety issue, which is your patient identification. Why? And why is so important? Because sometimes every kids look similar because we are not their parents. So for the kids, you know, when they look similar, it's very, very dangerous. You might give wrong medication or wrong treatment to wrong children. So we need to identify your patient. So when you give treatment or give examination to any children, we will use their name and their date of birth as identifier to tell that you are giving treatment and examination to the right patient. So this is, I want to remind our students, because from my experience, the patient identification is related with lots of sentinel event or adverse event, or you give treatment mistakenly to the patient. So after we give the examination and treatment to the patient, especially pediatric patient, we move them into observation area. So in observation area, there are some issues you need to be very careful. In Taiwan, this happened very, very few times, but in United States, this is very important issue, even in some Western country. I believe in Indonesia is also very important. That is, before COVID-19, I think everyone is free to get in and get out into the hospital, right? So they can also get into ER. So when you are in emergency room, you need to be sure that the parents, they accompany their children at all times, because sometimes the kids, they might get lost. They might be adopted by someone and they might be in danger. So in the observation room, the safety is very important. So after observation, they might be admitted into hospital, or they might be discharged from the hospital. So before they discharge from hospital, the patient education is very important. So the patient education we will give by nurses or by doctors or by our other healthcare providers to the parents or sometimes to grandparents. And you might ask why I emphasize the importance of discharge patient education. Because if you did not give enough health education to the parents or to their grandparents or even to the teacher who accompany the children to university or to hospital, they have very high possibility to come back, to return back to the hospital again. This will increase the revisit or readmission of the hospital. And this will also be not good result for both healthcare providers and the parents and also for the children. So this is 6 steps of the patient flow in ER. And in each step, in the following slide, I will share with you, there are some important factors that we have to consider when providing care to pediatric population. So before I move on, I want to ask you, in Indonesia, what is the age definition of pediatric patient? In Taiwan, if you are under 18, you are from 0 day, for example, today you were just born, until you are 18 years old, you all belong to pediatric patient. How about in Indonesia? Do you have any age definition of pediatric population?
Yes, I think for the age of pediatric, I think the same with Taiwan, Prof. We use the 18 years old for pediatric.
Okay.
Above, this is include in, yes.
Okay. So because of this very big variety, can you imagine that the children, they are 6 years old and they have been seen by the same doctor with the 12 years old, 16 years old, or even 18 years old. And for this very wide age range, the growth and the condition of each children, they are so big difference. So that's why, when you provide care to pediatric population, it's very, very big challenge. And especially for ER nurses, because for some children, they are almost like adult. I believe some of the students, you might have your family, or you might have children, or maybe there are some younger brother or younger sister in your family. And, when they grow up to 14 or even 15, they are like an adult. And you treat them physiologically, it's like an adult, but psychologically, they are still like a teenager or adolescents. So that is why it's very complicated to provide care to pediatric population, especially in emergency room. So when we provide care to our patient, no matter you are in triage or you are nurse in treatment area or in observation area, even you are nurse working in pediatric floor, or you are responsible for discharge of the pediatric population from your hospital, we always have 5W, 1H to ask, to observe for your pediatric population in emergency room. So I will take one example. So this 5W, they are who, where, when, what, why, and how. So for example, today, if you are working in the ER and you are very advanced, so you were assigned as a triage nurse working in the ER. So today, when your patient come to you, you might ask who is this patient? That will be how old of this kid. Maybe he or she is 7 years old, or 12 years old, or 16 years old. And you might ask why I have to care of their age, because if you look at the human growth, these age differences will make a very big difference on their personal development. So for a 6 years old kid, maybe their body figure is like really like a kid. But when they are 12, they might be pre-stage of the sexually mature. So for girls, they might have a period. For some boys, they might start to have a pubic hair. So when you discuss some issues with them, there will be some factors we have to concern. And if they are 16, 17, or 18, they might have higher possibility to be pregnant. So let me give you an example. When I'm working in the ER, if we have the patient, pediatric patient, they complain abdominal pain. If this patient is 6 years old girl, I believe she is still not sexually mature yet. So I will not check the urine pregnancy test of this 6 years old girl if she is not sexually mature. But for the 12 years old girl, or even for 16 years old girl, I must test the pregnancy test from the urine before I give her any chest X-ray or any treatment they were involved with the influence of the fetus. So that is the very important factor we have to observe in who. Another issue for who is who accompany them, because this is very important. They will give you a clue whether this child has been abused, sexually abused, or violence abused. And sometimes if the kid accompanied by parents, mother and the father, you also have to observe the interaction between the parents, because sometimes the father or the mother, one of them, who might trigger the domestic violence to the kids, and that will be some potential we have to pay much more attention. So let me give you a real example in Taiwan. I remember back to 1997 or 8, if I remember correctly. We have one girl. She is around 10 years old. She was abused by her father. Her father hit her, that triggered domestic violence to her, that caused the brain injury of this girl. This girl was sent to a ER in Taipei municipal hospital because they don't have enough ICU to provide care of this girl. So she was sent to Taichung, which is the middle of Taiwan. That might be 250 kilometers away of that hospital. So finally, unfortunately, this little very cute girl was dead because of the brain injury. But why I take this example? Because this girl has ever visited this hospital several times, and the ER nurse never ever observed she has been abused by her father. And from any physical sign, any bruises, the ER nurses, they did not observe that. Another example is actually this girl's mother also was the victim of domestic violence, also have ever been to this hospital. So this is an example. We have to observe who, and that is very important. Second W will be where. Where are they come from? Why the where is very important? Because sometimes we might have some disaster and they might have some mass casualty, or we might have some food poison from the school, or we might have some terrorist attack. So we have to observe, because if you observe there are more than 2 or 3 children, they visit your ER from the same place or experience the same activity or the same accident, you need to pay attention, because you might need to activate your mass casualty management system in your ER. So that's the second W. Where are they from? Another one is where are they from might tell you their economical status, because some children, they might from very poor economy status area. So you might need to pay attention. There are some issues related with their health. So the third W is when they come in. So this is especially very interesting. When I work at the night shift in ER, I always receive the children at midnight, like 1 a.m. or 2 a.m. Guess what? They always have asthma attack. They might have asthma attack, especially in the at very late night. Or I have children, they visit our ER in the daytime, in school hour. Why? You can guess. Most of them, they have injury because they might fall from the school. They might get some injury at school. So that's why they visit the ER at school hour at daytime. So this is also tell you some information for you to provide care to them. The fourth W is what. So when they come, what clothes they wear and what are attached to them. And also you have to seek what evidence that can be very helpful for you to give you some clue to treat the patient, to treat those children, or to protect them. So for example, when I see the children, when they come in, they are just crying, and I can observe their interaction between the children and their parents, even their grandparents. If you can see the kids, they look very anxious, or they have some fear in their eye, like they are afraid of those adults, you might guess they might experience domestic violence. At this time, I will check them from their head to toe. So we might take off their clothes to check, do they have a different level of bruises? Because if they have a bruises that occur at different time or different stage, they are telling you they experience domestic violence. So this is another factor we have to consider for what. And another is why. Why have two whys? Why they come to ER? And why they come to ER so late? Or why they come to ER without anything that you can observe from them? If you cannot observe anything from them and they just visit ER, you might have another clue of domestic violence. Let me give you an example. I have several times I received a patient, they visit ER maybe in the midnight, 1 a.m. or maybe 12 p.m. but 12 a.m. or 11 p.m. Usually for children, it's time for them to go to bed. They're supposed to sleep, but their mother bring them to ER. So you can see the mother looks very nervous. The kids looks like a very innocent. And the mother say, oh, my children has something have to be seen by doctor. So we ask any symptom or signs. The mother cannot, have very clear statement of that. Guess what? The mother was hit. The mother experienced domestic violence together with the children. So the mother brought the children to ER, want to seek for protection. So why is also another factor. Finally, is how they come here. This is the one I told you at the transportation, and how they come here by walk, by ambulance, or accompanied by police, or accompanied by someone. So those are 5W1H. They are very important before I introduce some treatment or some nursing care of some specific disease that have been commonly seen in pediatric population. So I also hope that as our student, no matter you work in ER in the future or you work in other unit, when you have the patient, before you start to do the patient assessment or before you start to provide care to your patient or even their family, the 5W1H is always the things that you want to ask them and you want to observe them. So before we start to talk about the pediatric nursing care, I would like to give you some references for this population, especially some references we observe from our patients, pediatric. So their vital signs. So usually for the children, because their age variety is so big, from 0 months, 1 day until 18 years old. So usually their breathing rate will be 20 to 14 times per minute. It depends on their age. So you need to have some certain idea what age of children they will have a different rate of breathing rate. Another one will be pulse. Pulse will be 80 to 100. So the younger kids, they have a faster pulse. The blood pressure will be systolic. They has a formula, which is 70 mmHg plus H times 2. So that will be the usual range of the systolic pressure. And for diastolic, usually it's like a 30 above. So for the temperature, it depends on different system. Sometimes we usually check the tympanic temperature, that's from their ear. So if they are under 35 degrees Celsius, they will be hypothermia. If they are higher than 38.5, they will be hyperthermia. But there's one thing I have to suggest you. For the children, if they are like 3 years old, 5 years old, the 37.5, you need to consider that they are already has fever, because the children, their BMI is very small. So that is the different things that we have to consider. And for signs and symptoms, if you are a triage nurse or if you want to observe from the pediatric patients, we have a linguistic and non-linguistic. Some children, they are very good. They can communicate, they can comprehend what you ask them. But sometimes it's just very difficult for nurses or for doctors to communicate with them. At this moment, you have to observe there's some non-linguistic body language. So I will also give you more information in the following slide. So they always have some visible signs, but they also have some hidden signs. So sometimes we have take off all of the clothes of the children, or we need to do a deeper observation. For example, do they have the bruises, or do they have some hidden injury that they are covered by the clothes, or they have ever experienced something that you cannot physically see, but when you talk to them or when you observe their behavior, they can tell you. So there will be some hidden signs, and they are involved with the signs of symptom of some specific disease or some specific phenomenon of the pediatric population. So if you want to do the history taking, physical assessment, psychological assessment, or all types of specific assessment for pediatric population, we always want to get the information from multiple information resources. So those resources, they might be parents or grandparents or their companion, someone accompany them, like their teacher or their neighbors or their friends, or even we want to collect some information from their home environment or school environment, because all of those information will give you best reference for you to make decision making, how to provide care to your pediatric patients. So don't rely on single resource. For example, I have seen some kids, some patients in the ER. So I saw different types of bruises on the children, on their leg. So very interestingly, at the time, parents and grandparents, both of them came to ER together. Oh, you must think, oh, these children is very lovely. That's why mother, father, grandmother, grandfather all come together, accompany you to ER, right? You think so? No. This is sometimes unusual for me because why they come together? So I try to separate them. So I ask information from separately from 4 of them. Guess what? Information I got for why this kid has such injury. The answer is all different. Can you believe that? And they live together. All of the causes for the injury, they are different. So this time, they will have a red flag fresh in there. They might remind you, is there something wrong here? Why, if you are family and you live together, why the answer to what caused the injury of the children? They are different. And so you make sure they live together or not. And fathers, mothers, grandparents, their answer, they're all different. So this is why I suggest you, we need to collect information from multiple information resources. But sometimes, people get to be very nervous. So sometimes their confusion existed. So you also have to clarify their information. So this is from my experience that when we want to collect information, and this is also the references for pediatric population in ER before we provide care to the pediatric population. So in pediatric population, we have 5 steps for the assessment and the treatment. So first one will be a general assessment, and I will have the detail in the following slide. Second, we'll move to primary assessment if you have some finding or some signs and symptoms that trigger your further investigation of this pediatric population. So after primary will be secondary and tertiary assessment. And after you've gone through general assessment until tertiary assessment, if the patient has life-threatening status, you might perform the PALS, PALS for the children. And even some big child, like they are 16 years old, maybe they are even taller than me, or maybe they are very tall, you might want to perform the the ACLS. So for children, we all usually perform the PLS or NRP, the neonatal. So it depends on the age and the size of the children. So I will explain the detail when you provide care to the pediatric population. So first one will be the PAT, Pediatric Assessment. So the triangle. So pediatric assessment triangle, there will be appearance, work of breathing, and the circulation to the skin. So first one, if you are triage nurse or when you first time approach to the children, you want to look how the kids looks like. So you will look at their muscle tone, their skin tone, and the tone of their crying. So you want to interact with the children. So some children, even they are very uncomfortable. When you make them giggle them, make them to smile, they might give you some smile. But some they just be very, very irresponsive. So in my case, are you sleepy? Or you might lose your consciousness, or you might cannot pay attention, because those are signs for dehydration, or the patient, they might lose their consciousness. So their interactiveness, also cancellability. Cancellability means the parents, they can tap them. They can tell, okay, don't cry, calm down. And if the children, they can be a little bit less anxious, this means they are cancellability is okay. So for some children, they very ER, their interactiveness is low and their cancellability is low because they cannot be tapped down. They just keep crying, keep very irritable. Another one will be abnormal look or abnormal gaze. So the look, like these children, doesn't look like regular children. The way they dress, the cleanness, and even sometimes the children, they can walk. So if they didn't walk, but it's just fine. The children, they cannot walk. Usually they can walk, but they cannot. So the way they walk, so, and on the gesture they have when you approach them, so it's also part of the observation. And do they have abnormal speech, or they just cannot stop crying? Especially some children, when they are crying, we have to pay attention to their chest wall expansion. Usually, if you cry, your lung will inhale and exhale, right? You breathe in and breathe out. Some children, when they breathe in, their chest will collapse. This must have some air hunger or some sign for respiratory tract. So this is appearance, first triangle appearance. Second one would be a circulation to the skin. So you will touch their skin to feel the temperature. Usually the children has a little bit higher temperature than the adult. So if you found the skin is very, very paler with less warm, they are so cold, and the skin is very moist, it's cold and moist, and the skin is so light that could have a less circulation. So that would be the evidence for circulation of the skin. Another one for the molting. The molting means the skin has like some spot. So sometimes it looks like a bruises, or the bruises over a period of time. Or sometimes the children might have a skin problem, or they have been burned, or some scar from that. So that would be the molting. Another one for cyanosis. So cyanosis will definitely be the evidence that the children have very, very low oxygenation of their of their body. So that will be circulation to skin. The last one of the triangle will be walking or breathing. So when we want to observe their breathing, we observe, is there any strange sound? Like some children, they might, like this one. This is very typical, like a Riger or Strider, or if they have air hunger of the children. So their breathing sound and their breathing position. Some children, they use tripod position because it's easier for them to breathe in. So some children, they just cannot lie down because it's very difficult for them to breathe. So they have to do the semi-phallus position. They have to raise up the degree of the bed. So this is a position. Another one is for retraction. So this is the one I told you. When you breathe in, supposedly you will expand your chest wall, your diaphragm will be lower for increase the space of your chest wall. But for some children, when they breathe in, their chest wall collapse. So that will be a retractions. Another one, we observe their nose. So when they breathe in, their nose is like vibrating. This is flaring. This is another sign of abnormal breathing. And of course, if we look at, do they have apnea or gasping? Gasping like like very difficult for you to breathe in. So this is a pediatric assessment triangle if you work as a nurse or if you work as a triage. So let's move on. If you receive a patient, they are in severe situation after your primary assessment. So we will look at the A, B, C, D, E, especially for the children if they have experienced disaster or mass casualty. So if they have a catastrophic bleeding, so you will look at it, do they have a bleeding? And you want to assess, because we want to determine the priority of giving them treatment. So we want to look at, do they have life-threatening hemorrhage? So if they have the bleeding, we need to apply direct pressure or compression bandage to stop the bleeding, or we will even use the tourniquet. But I don't suggest you use the tourniquet on the children because the extreme is very slow and their BMI is very small. So that will be the C for breathing. And then the A will be airway compromise. And of course, we look at the position, potency, and to look, do they have a need for protection? So we want to lie them afraid, we want to lie them down. And sometimes we will use the just thrust. But for the little kid, if they are younger than 6 years old, we don't suggest that. It depends on the size of the children. Then we'll look at, is there any respiratory failure? So we'll look at the sign for apnea or poor effort sign of the tension pneumothorax. So this is especially for the teenager. If they are 16, they have lots of exercise. And some children, they are very tall and thin. And for this kind of body figure, they have high possibility to have a pneumothorax, or they might have a recurrent pneumothorax. So this is another one we have to observe. And then there will be hemorrhagic shock, especially if they have experienced some traffic accident or injury, or they fall from the tree, fall from the building. So we will look at the hemorrhagic shock. So we check the skin. So you can apply the previous one, PAT, Pediatric Assessment Triangle. Remember, I told you about the circulation to skin and appearance. So the C definitely will be very useful assessment. Then in the D, we'll look at three things. First one, severe head injury. Then impending herniation or neurological shock. So those are also related with what I just mentioned about the traffic accident and also they fall from the tree, from the building, or they have experienced some domestic violence. Like the girl I told you, the 10 years old girl, she experienced domestic violence from her father. So she got a brain injury. So finally, it's the E. There will be exposure. So exposure will be when we check the patients, we have to give them some protection. So we have to look at it. We don't want to let them exposed to cold air. We want to cover their privacy. So the C, A, B, C, D, E will be the secondary assessment for the pediatric population, especially in ER. So let's continue to the sample. So sample will be SAMPLE, which is another one. It's a simple one from the C, A, B, C, D, E. So we want to observe their symptoms. After you give them the PAT, we observe, do they have any chief complaint? The chief complaint, sometimes you can collect from the patient because the children, they cannot communicate well. Maybe they are very little, 2 years old, 3 years old. Then we check the allergy. So allergy, you need to collect the information from the parents and also ask them, do they have similar allergy before? And also their environment is very important. And the food is definitely, you need to pay attention. Some children, they are allergic to peanut, especially in the United States. They have several cases. Some children, they are allergic to chocolate, to mango, or even some, they use, some children, they want to, follow their mothers. So they use their mother's cosmetics. And some cosmetics will cause allergy to the children. So like allergic asthma, or you can look at they have a dermatological allergic reaction, their skin. And another M will be medication. So you want to check, do they take the prescribed medication or they use the over-counter OTC? OTC means you buy the medication directly from the pharmacy without doctor's prescription. Or some family, they have the tradition, give the children herbal medicine. And the family didn't think the herb, they are medicine. So for example, they mix herbs with some water to make a soup and they want the children to drink. But actually those herbs, they contain some effect of the medication. So I think that will be a very important thing you have to pay attention. Then past medical history. Do they have a genetic disease before? Or do they have some congenital defects? And very important one, nutrition, which is their less oral intake. So in addition to, you ask them, what did you eat? Your previous meal, or what did you eat recently, recent 3 days or 1 week? You also want to ask them, match their growth curve, because some children, they are below the normal growth curve line. So you also have to pay attention to that when you are doing the secondary assessment. Finally, is the event. The event actually is when this attack, when you have such chief complaint or chief signs and symptoms? What are you doing at the time? Or have you ever joined or participated some event that caused your current chief complaint or current signs and symptoms? So the SAMPLE is sample. This sample principle is very important if you trigger the secondary assessment after you did the PAT. So after you've gone through all of the assessment, you think there is the need for the children to have the further investigation. So we might have a screening, the screening including PAN assessment. So PAN, we also use FLACC FLAC tool, or we use Warm-Baker to assess the PAN. Then we might check chest X-ray. So remember I told you, if the patient, they are girl, they are female, you have to look at the age for their sexual maturity, because there is possible, if they are 12 years old, they might get possibility to be pregnant. If they are pregnant, you want to check their pregnancy test before you give them the X-ray, because they might have a radiation exposure. So don't believe what the patient told you. This is, let me mention again. Let me give you an example. I have a patient, they are 16 years old. 16 years old has a possibility to be pregnant, right? So the patient complains. So 16 years old, they are belong to pediatric patient. So I asked her, we are going to give you the abdominal X-ray because you complain abdominal pain. So before this, I want you to drink water, and we want to give you the urinary test for your pregnancy. The girl said, no, it's not possible. I just had my period yesterday. It's on right now. How do I know? So I say, yes, I respect what you told me. However, this is our routine. Please drink water and do the urinary test. After that, we will give you the abdominal X-ray. All right. She persists. She doesn't want to do that. But I told them, this is our principle. You must do this one. Guess what? She is pregnant. After the pregnancy test, even she say she just had period come yesterday. I don't know. This is your bleeding or your period. I don't know. So that's the laboratory data to tell us. So this is what I want to remind you when you are doing the ER for pediatric population. So you might want to do the laboratory study, blood, urine, stool, or the CT or MRI if there's a need. For example, if you got a brain injury, you might do the CT or MRI or other tests. So that would be tertiary assessment. So after you have gone through all of them, then I will introduce some common thing, the disease that are in ER based on my past experience. So there'll be UTI, allergic asthma, fever convulsion, or fracture. So in the fracture, in here, since I already shared with you the PPT, so this is a guideline from the Canada in the hospital. They have very, very comprehensive, all different kinds of fracture guidelines. Because of time limitation, I will not show you this time, but there's information. You click it, and they will have information for you. So infections, carbon flu, and then even the carbon monoxide positioning and the drowning. I think this is especially for the children at the school age and infant sudden death. So I will give you a very brief introduction of this one. So allergic asthma. So this is the photo I took from the internet, from the vector stock. This is not I create by myself. It's a vector stock they created. So in the asthma, there will be some signs. So when you are doing assessment, we observe like the PAT I told you, from their breathing, difficulty, shortness, and dry cough, and even they have night cough. So that's why the 5W1H is so important for you to collect information. But you might ask, what caused the allergy? Because when you are doing patient education at discharge, you want to educate the parents what they need to be what they have to avoid. So their household chemical, like you use for cleaning, your dust, even you have a genetic defect, and the food, especially fatty food, they contain the peanuts or some chocolate or something. Alcohol, of course, but for children, maybe that's not possible for them to take alcohol. But in Taiwan, sometimes the high school student, they are 15 years old, 16 years old, they still drink alcohol. Although that's not illegal, but some of them is to try it. Virus and the pets, they have dogs, have cats. It's easy to cause the allergic asthma. And of course, the pollution, especially PM 2.5. Then febrile convulsion. So because of time, I just offer this from the GP pediatric strip on the internet. So you can see this is an algorithm that you can check when they have the different type of tonic-clonic seizure, and if they continue, and most important, if the children or your patient, they have a seizure, you have to keep their airway open, or you have to pay attention to their vomiting, because the vomiting might stop them from breathing. So this is the algorithm you have to pay attention. I want to remind you for the airway maintenance because of time. So I won't spend too much time here. Another one will be scald and burn. I think, for some children, they are very curious. So it's easy for them to get burned. So scalds and the burn, they are different. So scalds, they are caused by hot water and steam. I think this always happens at home or even sometimes at school. And for the burns, this might be some fire in their environment or sunburn. I think in Indonesia also, some children, they just don't care. In the summer, they like to play. So they're exposed to the sun and they got sunburn. When I was a child, I had ever experienced 6 times of sunburn. In the summer, I just take off all of my skin from my neck and from my back. My mother said, "Are you an insect? Why you remove all of your skin?" So you'll get sunburn. Or sometimes they get chemical burn or electricity, especially for children. Your plug, they might cause electricity. So for the treatment, it's very important. But I want to remind you, if they have a burn, for example, there are some burn with the clothes, so you have to take off the clothes. But if those clothes, they are stuck to the skin, do not remove them. This is why I want to remind you. And we will give them pain relief, and we might have a dressing. But when they got burned, we will use the cool running water. Don't use ice to pack it directly, because this might cause hypothermia, and this might cause the skin contraction. Also, no ointment, because ointment will keep the heat inside the tissue. This is not what we want. So don't put ice packing directly, no ointment. So we use cool running water, and be sure the water is clean. Don't use the dirty water to cool them down, because they might cause secondary infection for the scald and burn. So after that, there will be viral gastrointestinal. So for example, we might check their signs for watery diarrhea, but you need to be careful. If they have a bloody diarrhea, especially the diarrhea looks like a strawberry, there might be another severe infection, or they have some structural abnormality. And we check their cramps, pain, and muscle ache. And of course, we look at the content of their vomiting, and we observe the nausea. And if sometimes they have also have occasionally low-grade fever. So this is a typical sign for viral gastroenteritis. So the treatment, of course, because children, they are very easy to get dehydrated. So we will have the replacement of fluid, and especially the electrolyte. So sometimes we give them the drink like they contain salt, sodium, potassium, calcium, that kind of drink to electrolyte replacement. And when they have those gastroenteritis, we don't want to give them fat food and prevent the milk and the lactose product, because this will cause more irritation of your GI tract. And that sugar, and of course, no caffeine for the children. And you might ask, many children, they don't drink coffee. How come they have caffeine? Do they drink ginger ale? Ginger ale is kind of like a sweet bubble drink. They contain very high caffeine. The ginger ale has that. So this is, we have to pay attention when your patient has the viral gastroenteritis. Another one will be URI. And the URI most caused by rhinovirus, which is the virus found in your nose. And the rhinovirus, they are very easily transmitted by air and direct contact. So the symptom like a runny nose, so you will assess all different patterns of the breathing and the breathing sound. And they might have a complication, like they might cause by AOM, because they're infection of your ear, your nose sinus, or your throat, and also from pneumonia. So I want to remind you 2 things. If your patient, they are younger than 18 years old, I don't know in Indonesia, usually for your treatment for URI, do you give aspirin or not? Some Western countries, they give the children aspirin. But if you're under 18, we don't suggest you to give aspirin because they will cause Raynaud syndrome. That will be another secondary complication. And if they are younger than 6 months for the infant, don't give them ibuprofen, which that we usually use for pain treatment. And some people use them for cool down the temperature for URI. So this is a reminder. For drowning, I think this is very commonly seen for the children, especially in the summer. And I believe in Indonesia, you have lots of islands. They always have this happening. So we are not only looking for the treatment of drowning, we want to find the cause. What caused them to be drowning? So some, maybe they go to the deep water. Okay, this is usually seen. But sometimes some physiological factor also cause drowning. For example, the children have a seizure, which is epilepsy, or they have some cardiac congenital defect that cause cardiac dysrhythmia. And they have a type 1 diabetes, like hypoglycemia, or parents didn't pay attention to them, didn't watch over them, then they just got drowning. So they are neglected. So in the assessment for drowning population, we will observe assessment for cause of drowning, history, and we will check their blood gas for the oxygenation. Chest X-ray, or want to check, do they have a cardiac congenital defect? So we check the ECG, and for the blood, we check the CBC, electrolyte, and of course the sputum, because sputum will give you some idea whether they got lung infected. So especially some children fall into the river, which is very dirty, or they fall into the river, they have lots of mud, and they inhale the mud. So their sputum will show you whether they got what kind of bacterial infection or not. So in the management of drowning, of course, the ABC, we check the airway competency. We want to make sure the oxygen SpO2 greater than 95% ideally. Circulation, and also the GI and the genital urinary. This is the one I told you, if they got drowning in the very dirty river, they might cause the GI problem or UTI. And be careful of the hypothermia. Even in the summer, when they get into the river, they still has possibility to cause hypothermia and of course the infection. So the carbon oxide poisoning, this always easy to happen in the winter, especially in Taiwan, we are very cold. In Indonesia, maybe they are caused by different mechanism. So if your home has a gas powered generator, charcoal grill, briquette for cooking or heating, or you use some powder stove, those things, or even the fire boats, they have a generator. They might have a possibility to cause the carbon monoxide poisoning. So the signs and symptoms, there'll be headache, dizziness, and their skin always tend to be pink of those carbon monoxide poisoning. And they might also have, they might also have a pain, or they change their mental status. So the management is we give them 100% oxygen, and if you got equipment, we might suggest that you give them hyperbaric oxygenation to increase the oxygen saturation into their brain. And we might want to prevent for a cerebral edema, or we need to have a cardiac management for a drowning patient. So you might have an airway intubated. So finally, this is SIDS. I think if you work in the ER, this is very, very critical situation. You can see the parents, they bring the children just rush in and shouting, please help my kids. He or she is dying. This always seen on the infant. So SIDS. So the SIDS is unexplained death. And usually the parents find their infant has SIDS during the sleep. And this is usually seen on the baby less than a year. So there are several factors, physical factor, like they have a brain defect of the children, or low birth rate because premature, and also respiratory infection because of URI. Another one for their sleep environment. So that's why I keep telling you, 5W1H is very important. Sometimes they from their sleep environment because they sleep on the stomach. So they like upside down. So they sleep on the stomach or on side. Then the children is difficult to turn themselves. Then they got a pillow to stuck into their respiratory tract, or they sleep on a soft surface. So the airway got stuck, and they're sharing the bed with their sibling. So or with the parents. So sometimes parents make them have apnea, and parents didn't know anything. So this is sleep environment factor, or overheating, because we are afraid they're getting too cold. So we give them overheat. Overheat is also one of the factors that cause sudden death of the infant. So another risk factor, like their age, their gender, family history, and smoking. So also the mother contribute to the risk factor of the SIDS. Like a mother give a baby deliver at very, very young age, younger than 20. Or the parents, or especially mother, they also smoke. Or the parents, they use drugs and alcohol, and also inadequate prenatal care. So those are the factors you have to ask when you are doing the history assessment and observation in the ER. So I think because of time, for an hour, so those are the commonly seen disease I share with you very quickly. And I know for the undergrad student, I don't want to talk too detailed. I just want to remind you again, if you work in the ER, your constant assessment, reassessment, observation of the 5W1H is very important. If you have a doubt of your patient's situation, do assessment immediately. And that is very important. Also, you have to observe the family interaction or the children's interaction. That is a very important information that will provide you in ER care. So thank you very much for spending time to listen to me. And I hope my experience share from my ER work will give you a little bit useful insight that we hope our children, they under your care, they will be very safe. And I also hope our international children, they can grow up and finally come to Taiwan to visit us to see Taipei 101. And Taiwan welcome you. Thank you.
Okay, thank you so much for sharing with us this interesting topic and wonderful experiences, Prof. Okay, for your information, all participants in this event consist of our faculty and staff, also students of Diploma 3 Blitar Nursing Program, Prof.
Okay, thank you.
Okay, well, for participants, it is time for discussion session. You can type your question in this Zoom room chat, or you can directly ask question with turn on your microphone and your video.
Okay, Mr. Andy.
Yes, Mr. Agus, you have
Okay, maybe before you read the chat on the chat room, some question for Professor Fu.
Yeah.
Maybe exactly I want one of our students like try to ask some question for Professor Fu directly. And then, okay, sir, I am Agus Karul Anam, sir.
Yeah, nice to meet you.
Exactly, for this evening is very important guest lecturer, and then I am subcoordinator academic staff on Blitar Nursing Study Program.
Yep.
Exactly in our nursing study program, there are one specialist subject based on our vision and mission, as exactly on emergency nursing and disaster nursing. And then why we choose this special subject, emergency nursing and disaster nursing, because our regional on disaster regional, exactly we are surrounding in Cloud Mountain, sir. Cloud Mountain is one explosive mountain in Indonesia, and then every up to 10 years eruption, and then for disaster we also meet the children with on emergency pediatric. Exactly. Maybe I want to discuss about the scald and burn. Yes. You say that on treatment in scald and burn, they just use cool running water, no ice and no ointment. Maybe you can give some reasoning why we avoid to use ice and ointment.
Okay.
And then thank you very much for your answer.
Yeah, I think this is very important, and I want to thank you again for reminding this to raising this issue. Usually we think because you are very hot when you get the burn, right? So you want to cool down the temperature. That is appropriate. However, if you use ice, especially for children, they will cause hypothermia. Another one, they will cause the contraction of your blood vessel, which will contain the heat. They cannot let the heat go out. So this is the one of the reason we don't suggest you use ice. Instead, we suggest you to use cool running water, because cool running water can bring the heat from your tissue and from your skin to lower the temperature. Because of time, actually there are some articles, they talk about if you put your skin under the cool running water for more than 15 minutes, they compare if you put under 5 minutes, 10 minutes, 15 minutes, and even 30 minutes. The heat retained in your tissue is very, very dramatically different. And that is one of the reasons we suggest to use the cool running water. Another for the, don't use the packing as I have mentioned to you. It depends on the size of the children. But even for adult, when you use ice packing, like I say, your tissue and the vessel will be constricted, then the heat won't go out. So you might feel, oh, it's very cool. You might feel the temperature drop on the surface of your skin, but actually the heat still retained in the tissue. That will not be good for your following treatment. So that's the reason. I hope you get answer for the experience I share with you.
Okay, thank you, Prof. Maybe in disaster nursing, exactly for some victim, pediatric victim, exactly we get difficulties to prepare clean water.
That is very right. So let me give you exactly one example. So it's difficult for us to get clean water, but do your best to get the water as clean as possible. So in Taiwan, in 2015, we have a Taiwan Formosa water park powder explosion. We got almost 500 young men or young people. They got burned in one time. In 10 minutes, they are 500. So some of them, because this is a water park, so some of them, they jump into the river of the water park. And this water park is very close to the ocean. Guess what? They get cooled down, that's correct. But following treatment, they found there are some oceanary bacteria that go directly from the ocean to the river. So they found that kind of bacteria from their wound. And this water looks clean, but actually it contains some bacteria. So that's why I say, do your best as clean as possible. So, sometimes I know it's very difficult. So that's why I just say, ideally, we keep cool running water, but I don't want to say exactly you need to be sterilized water because that's not possible in disaster site. So just do your best.
Okay, thank you, sir.
Yeah. Okay.
And thank you, Mr. Agus, for your question. Actually, Mr. Agus is one of faculty in this school, professor.
Yep. And I think he just mentioned another issue. I know the time limitation, which is about eruption of the volcano. So the air pollution definitely is very important for the children during the disaster of the eruption of the volcano. So I encourage that in your country, in your area, you have to prepare the mask in your disaster backpack, especially for children. So we decide different form. Some people say, well, maybe N95, maybe a surgical mask, but N95 has a disadvantage. It's very difficult to exchange the air. So it depends on your logistics supply. But I also want to remind you, you have to prepare that for children as well.
Okay, thank you for your reminder, Prof.
Okay.
For the next, is there anyone would like to ask directly to Professor Lai?
I think there's a Kidif. He is asking from the grade 1A. He's asking, I talk about the breathing of the baby and the adult. Yeah, of course. He is asking why the baby breathes faster than adult. Actually, the babies, or they say the children, their chest wall and the capacity of their lung are smaller than adult, but they also need the 100% or 90% of the oxygen saturation. So in order to reach the same level of oxygen saturation, they have to increase their air exchange rate. So for adult, their lung is bigger, so maybe 12 to 20 times of exchange of the breathing is enough to reach up the 95% or 100% of oxygen saturation. But for babies, their lung is small, their chest wall is small, the capacity is small. So in order to reach the 95% or 100% oxygen saturation, they have to increase the air exchange rate. So that's why their breathing rate is faster. So I hope I answer your question for Hidif from the 1A.
Okay, thank you for the Hidif. It's very clear explanation. Yes, we have two participation who would like to ask directly to you, Prof. Yes, the first one is Finida. Finida, please welcome. Turn on your camera. Yes, please introduce yourself first.
Okay, thank you, Mr. Andy. Excuse me. Before it, I apologize because my English skills are still big.
Don't worry, don't worry.
Okay. Excuse me, Professor. My name is Finida Ramadhani. I am from grade 2B. I want to ask about the burn of children. It is stated in the material that sunlight is one of the causes of tissue damage in children, namely in the form of burns. What kind of sunlight causes this burn, and also what are the signs and symptoms that occur in children? Thank you.
Okay. Usually for children, if they got some burn of skin, they might be not super big deal because their skin generate. But another one you have to pay attention is that will cause the children have a dehydration. So it depends on the area. Like in Taiwan, some children, they might get skin sunburn, so they will feel very painful of their skin, right? But they also cause the dehydration, so they will have vomiting and they will have a vomiting or some geriatric symptom. So for the children, the sunlight is really depends on different areas. Like if you are in some underdeveloped country, they don't have protection of the sunlight, they'll be dangerous for them. And we have a different spectrum of the ray that radiate from the sun. So the one is like the spectrum will be the purple one, that will be the most dangerous one. So usually if the children go out for activity, we have two factors we have to consider. First one is the timing. We don't want the children to go out around the noon, which have the strongest sunlight, maybe from 11 a.m. to 2 p.m. or even 1 p.m. So this is one. So when the kindergarten or the school, when they design the activity, they have to consider for that. Second one is they need to have a sun protection. So we use the sunproof that to reduce the damage from the sunlight, or we encourage them to wear the hat. And sometimes some children, they wear that, some they don't wear that. Or in some country, they even use the umbrella. But I want to remind you, this have a cultural difference. The people in Western country, they like sunlight. So that's why they have lots of sparkle there, right? So they also have the possibility, they got sunburn of the children. But people in Asia, especially Indonesia, your sunlight is so strong. Also in Taiwan, that's why you need to cover and you have to wear the hat. So the cultural consideration is also, I want to remind you, because you might get opportunity to receive the patient from Western country, like they go to either of body, right? So when you ask them, you might feel, why don't you have sun protection? The cultural differences is you have to consider. So I hope I answer your question for what causes the sunlight and what is the signs and symptom of that. But be careful of the dehydration. Don't only pay attention to the skin. The dehydration is also a very important issue for children.
Okay. How, Finida? Is it clear?
Yes, clear. Thank you, Professor.
Thank you very much. Thank you.
We have one participant would like to ask directly, Prof. Please welcome Tel Ayu.
Oh, Ayu, you have many Ayu in Indonesia.
Yes.
I also have a student Ayu, yes. Nice to see you, Ayu. Maybe different one from my student.
Okay, thank you, Mr. Andy. I want to ask to Professor Fu-Chih about when a child is said to be critical and need to get emergency treatment immediately. Then what if the emergency is not immediately resolved due to economic limitation and inadequate distance to health facilities?
Excuse me, I cannot hear you clear. Can you repeat your question again? Then I can give you a better answer. Can you repeat? Don't be shy, just repeat again. I want to hear clearly.
Okay. When a child is said to be critical and need to get emergency treatment immediately, then what if the emergency is not immediately resolved due to economic limitation and inadequate distance to health facilities?
Okay, so let me ask you now, have you done CPR? Have you ever done the CPR? So that's why everyone have to learn CPR, because sometimes if the emergency care for the children, they are not available. And if we have ever done the CPR, we can save them. So some people close to the children, we can save them. And maybe similar principle we apply to adult can be used to children. But there are some different consideration. If they are children, they are smaller, so we will use different skill. That will be another issue. But I hope that Andy, you can teach them about the different skill of the CPR. So if your patient, the children, they need immediate emergency care, but they cannot receive that, I think someone that close to them can help them if they have ever done CPR or even choking. The kids, they are very little, like 3 years old, 5 years old, or 2 years old. They always like to put something into their mouth, right? And then they will get choked. Have you learned hemorrhagic maneuver? The hemorrhagic to get something into your airway out. The hemorrhagic. Have you learned that? Hemorrhagic maneuver.
I think the next semester, Professor, because she is
okay.
Second grade.
Okay. So next time when you take Andy's course or any course related to this one, please do your best to learn, because one day you might use this skill to help someone. They cannot go to ER, but you are there. You are a nurse. You are a nurse student. You help them, and you will feel very happy that you have ever learned this skill. I hope you done that, and I hope I give you the answer that you ask.
Okay, thank you, Prof. We have still so many questions in room chat, Prof. Is that okay, Prof?
Yes, I'm okay. I am all free this afternoon. Whenever you have time, you can ask me.
Okay, I will read a question in the room chat.
Okay.
This is from Alia. What is the biggest challenge in emergency pediatric nursing?
Okay. The biggest challenge is their parents. It's not the children. For me, I don't know in your country. Sometimes the children, they cooperate very well. But sometimes the one who always have the issue is their parents or their grandparents. That is why we have to communicate with patients' parents, and we need to give them health education. So the biggest challenge in Taiwan, we have very good training doctors. We have very good experienced nurses to provide care. But sometimes the parents, they did not have the healthcare knowledge. And then they think they can get information from internet. Maybe they are wrong, or maybe they are not that professionally explained. Then that will make our healthcare difficult. So for me, the biggest challenge is in communication. So sometimes the challenge from the children's parents or their grandparents, not directly from the children. Children, they are very cute. They can cooperate. We can treat them. So this is one of the biggest challenge based on my experience.
I think the same issue with Indonesia, Prof.
Yeah. So we all need to learn how to communicate with the parents. Yeah. I understand the parents feel very nervous. I understand their feeling. I don't blame them, but we have to do our best to, calm down the parents. If the parents is calm down, the children can be calm down. I have seen this so many times.
Yes, I agree with you.
Yeah.
Okay, for the next question, Prof. This is from Aida Imanwar. The question is the appropriate action to free the airway of a patient with suspected spinal cord injury is?
Okay, for spinal cord injury, actually there are special consideration. If I remember, based on the AHA guideline or some guideline resuscitation for children, of course, we have to look at the spinal stability for children. But some of them, they use the jaw thrust to like doing this one. But for children, we don't, especially the young children, if they are younger than 7 or 6 years old, because their spinal is still under growth. So for the children, if they are younger than 6 or 7, we don't use a jaw thrust and for stabilize their spinal. So, but we will put them into some very firm material to make sure their spine is straight. And when we want to move them, we need to be very careful. We have to keep their spine as straight as possible. So let me give you an example, and you can think about it. If you are outside, if you are school nurse working in the school after you graduate, that's possible. And the student told you, school nurse, we have one classmate fall from the tree. The tree may be 2 floors high. So when you came to the site, you saw the children was lying on the floor. That is the time you have to be very careful of the spinal stability. If you are not confident, don't move them. You have to assess the ABC first. Don't move them, like you say, oh, you want to make sure they are okay and just move them and turn them. You might cause the secondary spinal injury. So first of all, you make sure you assess their ABC and their consciousness. And if you are not confident to do that, just wait until the EMT come. They will help you to do that. Right? This is really my suggestion, because I don't know if everyone have ever received the training of the spinal stability. So if you never received that, if you have this happening, just try to make sure they're ABC, and that's it. Because we have seen someone just turn them, move them, then they cause the secondary spinal injury. Another one is someone they get right in a motorcycle, and then they get traffic accident, and they just fly in the sky and fall. They have a similar accident, and don't move them, and even don't try to move their helmet. Sometimes when you remove their helmet, you are also causing the secondary spinal injury for them. Just stabilize them, assess their ABC, make sure they breathe normally. I hope I give you the answer for that.
Yes, thank you, Professor.
Yep.
We have 2 questions. I think this question out of our topic, Prof. What do you think about the COVID vaccine that has not been?
Oh, this is a very good question. Okay, let me ask you. Yes, and we have a similar happening in Taiwan. In the past 3 to 4 months, from May, maybe around, I think, July, August. Before, we have very, very few cases of the children that got COVID-19. But we have one happening. Their children get infected by their parents, and they also infect their parents by the children in the kindergarten. So that is possible the children also get infected. However, we so far in Taiwan, if I remember correctly, we have, I think there's 1 or 2 cases, or maybe 0 cases. The children were dead from COVID-19. Maybe this is because they are kids. So far, we don't give the regular vaccination injection to children. There are 2 reasons. First one, we do not have enough evidence to see the vaccine is safe to children. So we cannot give to them. Second one, the children, they are very rarely been infected, and even they are infected, the death rate is very, very low compared with the elderly, compared with their grandparents. So that's why the priority in Taiwan, we keep COVID-19 vaccination is to give to the elderly, 70 years old, 80 years old. They are our priority. For children now, no, very, very few. I understand in the United States, or in other countries, they start to give vaccination to the children of like older than 5 years old, 12, but in Taiwan, no, because those two reasons. But I don't know in Indonesia, but I want to remind you before you give vaccination to children, because children, they are very different physiologically status from adult. You need to be very careful. You need to have lots of evidence to prove it's safe. Otherwise, maybe they were not killed by COVID-19, but they were killed by the vaccine, because there are some cases reported from that.
Okay, thank you, Prof. For the next question is from Elnona. I saw in the last slide, race is also a cause factor.
Yes.
Are there certain races that have a high risk of SIDS? Thank you.
Okay, the race, actually I should say there's a culture, because some culture, they put the children in crib, so they don't sleep together with parents like me. In Taiwan, some parents let their kids sleep together with them. For my parents, I don't sleep with them. I was put in the crib since I was born. I don't sleep together with my parents. So I can be safe, because sometimes, sometimes you turn. When you are sleeping, you just turn your body. You just turn and you are unconsciously turn. And the kids, they are very small. So you might press them, or your blanket might cause their apnea. So it depends on culture. Some culture, they allow or they encourage the parents, they sleep separately from their baby, from their infant. But some, they don't want to do that, because they want to provide best care to their kid. So they think sleep together with their baby is the best way. So that's why I say it depends on the culture. So, the cultural issue you need to consider when you are giving them the discharge health education. So if you have baby, like if you're working in the baby room, then you ask them when the baby discharge and bring back to their home, you ask them who gonna sleep together with the baby, or the baby will sleep singly in the crib. I suggest them sleep alone to prevent the SIDS, because there are several reports that because they sleep together, that cause the SIDS. You can put a crib, the neck very close to you, but just don't sleep on the same bed. For this reason.
Okay, thank you, Prof. For the last question, Professor, from the Yuli. When should a baby have the first physical examination after leaving the hospital? Well, physical examination is the top priority.
So I think this is a very good question. If the baby discharged from the hospital, from delivery, they say the mother deliver in the hospital, so they discharge very healthy, go back home. So when they do the physical assessment, usually it's the time when they return to the hospital for injection of the vaccine. So I think similar like in Taiwan, each baby, when they are delivered, they have a vaccination passport. So there's one small book. They are all different kind of vaccination. The children must receive all of them. If they don't receive, they cannot go to primary school. The primary school will say, no, you have to go to receive all of the vaccination. Or you have a special reason. For example, some children may be a health congenital defect or some health issue, make them cannot receive those vaccination. They might be the exception. But usually the regular children, everyone, you have to receive all of the vaccination before you go to primary school. So when they go to receive the vaccination, maybe the first time they will receive the physical examination again. Or sometimes we have the baby health clinic. So for example, the baby they deliver, they bring home, maybe they will ask them, okay, maybe the second week or first month, you have to bring your baby back to hospital for health check. So that will be the time to perform the physical assessment for the first time. And the top priority, there are several things we look, their ABC, airway, breathing, circulation. And we also want to listen to the way they cry. Why? Because we have evidence showing that there are some congenital defect or some disease you can find their crying sound, or the way when they're crying accompanied with the breathing pattern can help you to find some congenital defect or some disease in early stage. So those will be the factors for the priority we do in the assessment. And of course, their appetite, the way they eat, the way they breathe in, and the way they interact to you, like reflex, like the baby, we just can go here, and their tongue will move to here, right? Or you give them some shock, then the eye will close. So those are some neurological response you can also use for priority of the physical examination for infant. I hope I answer your question.
Yes, of course. Thank you, Professor.
Yep.
Because the time is very limited and
Okay.
almost 2 hours, Prof. And session should
Don't worry.
end here. Yes, again,
Okay.
thank you so much, Professor, for
Yeah.
sharing with us about the wonderful, experience and interesting topic. We hope you can join with us in other topic, other event for the future.
Okay, of course, sure.
Yes.
That will be my honor.
Yeah. As moderator, I apologize if I have mistaken during this event. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Yeah, thank you very much. Thank you. I hope to see you soon.
To Ayun as MC.
Okay.
Thank you. I say thank you very much for sharing with us Mr. Professor Fu-Chih Lai, RN PhD, as a speaker today. It was an extraordinary material. And I also say thank you very much for our moderator, Mr. Andi Hayun Abidin, SSD MSc. Well, let's wrap up our event today. Again, the announcement for the participants, the evaluation form is available in room chat, Zoom, and YouTube. So for the participants, please fill the form. The next agenda is praying led by Muhammad Herman Fernando. To Muhammad Herman Fernando, time is yours.
Assalamualaikum warahmatullahi wabarakatuh. Salam sejahtera bagi kita semua. Salam, Om Swastiastu, Namo Buddhaya, salam kebajikan. From Muslim, I will lead the prayer. From non-Muslim, please adjust. A'udzubillahi minasyaitonirrajim. Bismillahirrahmanirrahim. Allahumma sholli ala Sayyidina Muhammad wa ala ali Sayyidina Muhammad. Walhamdulillahirabbil alamin. Ya Allah yang Tuhan kami, pada hari ini kami melaksanakan kegiatan kuliah tamu dengan tema Pediatric Emergency Nursing. Berilah kami petunjuk, taufik dan hidayah-Mu, sehingga kegiatan yang telah kami laksanakan ini dapat membawa barokah bagi kami. Ya Allah yang Maha Pengasih dan Penyayang, karuniakan kesadaran, ketabahan, serta keikhlasan dalam menjalankan tugas mulia ini. Ya Allah yang Maha Berkehendak, perlihatkan kebenaran di mata kami. Bukakanlah jalan yang lurus menuju surga-Mu. Berikanlah kemudahan dan kelancaran dalam setiap langkah kami. Ingatkanlah kami agar kami senantiasa meneladani perjuangan para pendahulu kami, para pahlawan kami, dan pemimpin kami yang telah memberikan dharma baktinya bagi kami di masa yang akan datang. Ya Allah yang Maha Pengampun, ampunilah dosa kami, dosa kedua orang tua kami, serta dosa pemimpin-pemimpin kami. Berikanlah petunjuk dan kesadaran agar senantiasa melangkah di jalan yang Engkau ridhoi. Bimbinglah kami kepada jalan yang benar, serta jauhkanlah kami dari segenap petaka, khilaf, dan derita. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina adzabannar. So from us, if there is a wrong word that is less pleasing, we apologize profusely. Allahumma fiq ila akhwami tariq. Wassalamualaikum warahmatullahi wabarakatuh.
I say thank you for Muhammad Herman Fernando. Before we finish our activity, there will be a documentation session by documentation team. I plead for all the participants to turn on the camera. So documentation team, time is yours. Okay. I will lead from this session. I will start from the slide 1, and I want to count down in 3, 2, 1. Okay, slide 2. 3, 2, 1. Slide 3. 3, 2, 1. Slide 4. 3, 2, 1. Slide 5. 3, 2, 1. And last slide. 3, 2, 1. Okay, thank you for the documentation team. For the announcement, this program has a benefit to get a certificate. So for the participant who want to get a certificate, must complete the attendance and evaluation form. Ladies and gentlemen, finally, we've through all the event today. So I, as Master of Ceremony, personally, I would like to say I'm so sorry if there are mistakes in my utterance during handling all programs or session in this program. And I also say thank you very much for your participants in this program. Now, let's we close this activity with a sign Alhamdulillah. Alhamdulillahirabbil alamin.
Amin.
Ladies and gentlemen, now all the programs has been ended. So I, as Master of Ceremony today, I do apologize for any mistake. See you and wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Waalaikumsalam warahmatullahi wabarakatuh.
Thank you, Profesor.
Warahmatullahi wabarakatuh.
Oke, terima kasih Mbak Yesi. Pak Edi, Galek, matur suwun.
Ya, sama-sama Pak Agus.
Pak Edi, Pak Edi kita nih.
Galek, terima kasih. Walaupun disambi pekerti ya Pak Edi ya. Pak Edi Bu Yayu.
Selamat Pak Agus.
Terima kasih.
Oh iya, saya menang tak foto. Oh.
Ayam. Ya Mbak Yesi, makasih ya Mbak ya.
Sama-sama Bu Buki.
Terima kasih panitia, terima kasih semuanya yang sudah berpartisipasi aktif.
Sandi.
Iya Pak.
Prof sudah keluar toh?
Kayaknya sudah Pak. Tadi
Oh,
kata itu loh, apa bilang alhamdulillah tadi itu loh.
Oh iya.
Kan dikiranya sudah
Ya,
ditutup.
Tak kira omong-omongan Taiwan sama mau Rasido.
Enggak, soalnya alhamdulillah tadi persepsinya orang sana itu bilang itu langsung ditutup.
Lahir ya Mas.
Iya.
Ya wes.
Apa?
Oke, matur suwun panitia.
Matur suwun semuanya.
Saya akan ke laptop terpadu bawah evaluasi. Matur suwun. Kita tutup ya.
Oke.
Oke, monggo Mbak Anggi ditutup.
Oke.